Hi, everyone. Thanks for being here today for Business Success Through Inner Leader Development, a conversation with HealthStream and Skillsoft. A leader's internal voices are the ones that are often most overlooked, and regardless of our roles, each of us can be leaders in a multitude of ways. Supporting our staff at all levels means allowing them the opportunity to pause and think, how can I further evolve in order to make a more meaningful impact on the environment around me? Assisting healthcare staff in developing their inner leaders forms stronger teams with less burnout, mistakes, risk, and more connected productivity, cost reductions, and quality improvements. Here to share insight about providing staff with the right education to engage their inner leader is Mark Onisk, Chief Content Officer from HealthStream's expert partner, Skillsoft. Mark, thanks for being here today. Talk to me a little bit about why our customers should take an interest in leadership development and its importance for healthcare staff, clinical and non-clinical.
Yeah, it's a great question, Caroline. Thank you so much for having me today. I think at the end of the day, if you think about the construct of kind of healthcare and healthcare, patient care and delivery, many folks that are in frontline roles, they're in some of the most highly stressed, highly charged situations and environments that you can ever be put into as a human being, right? You're always in this kind of respond, react mode, where you have to respond with a level of empathy, a level of understanding, and a level of preciseness, because you're delivering some of the most sensitive and difficult information and messages that you can convey. At the same point in time, when you think about how many organizations and maybe many healthcare providers are structured, in many circumstances, you have folks that are in patient care, patient delivery that also have supervisory responsibilities, right? And they may be in the moment, they're always in basically that response mode. They're always very much focused on patient care, patient delivery. And they're not necessarily always equally as focused on their teams, or actually leading with empathy, leading with, maybe a balance of empathy and accountability. And in many cases, they're just happy to get through their day, right? They are not thinking about, hey, how do I actually, help my help my team mature in their career? How do I provide those career pathways? How do I provide the coaching? And it's because they're masters of their domain, their field. They're really focused on that one particular service delivery function. So the reason that leadership capability is so important is because that is really what really encourage people to stay within their job, stay within their role. In many cases, you find that, it's an old adage, but people leave their manager, not their employer. And I think that adage is especially true in a healthcare setting where, I've heard just anecdotally, people that I know that work in healthcare, they love the work, they love working with the people, and they're frustrated with their manager or the leader. Well, the way in which a manager or leader can kind of change that is by taking an interest in their team's professional development, their career aspirations, coaching them, being thoughtful, taking interest in them personally. And a lot of that comes through leadership training, because people aren't necessarily born with those skills. The other thing I would actually call out is that you especially find that in places where things are highly technical, where people have been trained and maybe in kind of patient care, patient delivery. Maybe they have a nursing or a healthcare background in some way, shape, or form that's very clinical. That's where they really need the human skills. And I would make the argument that organizations and enterprises really understand and really have effective leadership capability in the form of actually being able to take an interest in their workforce and their employees, promote career growth, lead with empathy and accountability, that they ultimately run more successful businesses. And you see that reflected in the surveys that go out to the patients. And I think you'd have to squint pretty hard to find a healthcare organization, whether it's a hospital, whether it's, any type of clinical setting where patient care surveys are actually off the charts, but the internal culture surveys are in the basement. Those two things are simply incongruous. Organizations that have very strong cultures, they're going to have very high patient care outcomes, very high kind of patient care response rates and surveys. So I think the two are correlated, and that's why leadership is so important.
Yeah, high quality care really does stem from high quality
Right.
leaders and managers as well. And that comes from high impact development. It's on our
Yeah.
existing leaders to
Yeah.
ensure education has that high impact.
Right.
There's a statistic that Skillsoft has shared in the past. It's 86% of learners using Skillsoft content provided by HealthStream report being able to apply what they've learned on their jobs within
Mm-hmm.
6 weeks. Talk to me a little bit about how we know that and then the true impact of a 6 week turnaround for developing leaders.
Yeah, it's a great stat. And the way that we collect that is every year we go through an annual survey of our customers. Our client success folks actually administer that survey. And they really, it's firsthand verbatims from our customers and from their learners who actually self-report and say whether or not they've actually applied what they've learned. So there's kind of two ways in which we do that. Certainly, as I mentioned, there's the annual survey we deliver to our customers that our client success team does. And then we also have another survey that goes out with our Percipio platform where we actually ask the learner, what's the likelihood that you're to apply these new skills? And typically those are going to be in the 80s to kind of 90% rate. So this 86% is kind of an amalgamation across a whole variety of measures, but usually that's the type of like learner application rate that we typically see.
When we talk about leaders, we're not always referring to specific managers or vice presidents, right? Can you provide an
Mm.
example of a less obvious situation where the more average team member can act as a leader in their role? And then maybe what barriers this person might encounter that make it challenging for them to act
Right.
as a leader? What do you think?
And I think in a healthcare role, this adage has never been more clear or more true. Everyone's a leader, but not everybody leads, right? And especially when you're in a patient care scenario where things are charged, everybody's at the same level. Titles kind of go out the window, and the focus has to be on the patient. In that circumstance where things are highly charged, everybody has to have leadership capability. You have to communicate effectively. You have to be able to delegate. You have to have shared responsibility, shared ownership. You have to be able to, demonstrate empathy in highly charged situations. You have to be able to, maintain your composure and keep your cool. Those are all leadership skills, right? And in that circumstance, it does not matter what someone's title is, right? The only thing that matters is the situation that you're dealing with, the quality of care for the patient, and your ability to deliver and execute upon that. And I would argue in that circumstance, everybody needs to have those leadership skills and capabilities. Ultimately, what's at stake is the quality of care for the patient, the consistency of service and care of the organization that's actually delivering that, and ultimately the outcomes, right? That's really what we're all here for. So um, I think leadership capability has never been more important. I'd also make the argument that we're actually in a very unique period of time where, we went through the most disruptive um, event in human history, right? That we've seen, at least in our own professional work history, which is, the pandemic, where you had work was completely virtualized. You had, and again, in the healthcare setting, our frontline healthcare workers were placed under enormous amounts of stress, right? You had incredible amounts of turnover. And in some cases, you have people that have been in their roles for 3-4 years, have never had any type of professional leadership training. And, that is really kind of the glue that keeps an organization together, that actually preserves kind of that patient care experience. So it's never been more important to really be invested and invest in that skill and capability.
Last question for today, Mark. So, investing in education, given all that we know, it also means wanting to see results, right? So, what would you like to share about the positive organizational and culture changes that can stem from impactful leadership development?
Yeah, it's a great question. And I think I'll go back to my earlier statement. Ultimately, great leadership results in great cultures. Great cultures result in great outcomes for the patient. And again, I don't think you could ever point to an organization who has had a really poor culture survey and somehow that results in great patient outcomes. It just doesn't. And so if you're serious about, providing the highest quality of care to the patient, and really serving the patient, then you really need to serve the leaders first. And that's where you need to focus. And I think those are probably the clearest kind of evidence of ROI and outcomes. And that's really where organizations really need to focus their efforts. So those are probably some of the ideas and thoughts I would put out there. We certainly have a whole host of different case studies and ROI examples on our website at skillsoft.com that I'd invite people to take a look at. But I think the actual ROI is pretty obvious, and I think that's a pretty obvious argument to make to a stakeholder, a buyer, an executive sponsor that you're convinced, and would be happy to be very supportive in that dialogue and discussion.
Thanks, Mark, and thanks for always driving this back to what it really comes down to, which is the patient outcomes, that quality care. So thank you. Yeah, this was a wonderful conversation. Appreciate your time today. And for those watching, we hope you'll share this information with others at your organization as we all work together to foster a culture of inclusivity and belonging and improve care outcomes together. Thanks for watching.